introduce you all with our next session chair, Dr. Vipin Saxena, and our keynote speaker, Dr. Praveen Shinde. I would like to welcome them on stage and request Dr. Shikha Agrawal ma'am to greet them with a bouquet. Dr. Vipin Saxena. He has completed his B.Pharm from VNS Institute of Pharmacy Bhopal, M.Pharm for RGPV Bhopal and PhD from Texas A&M University College of Medicine. He is currently working as Senior Director of Product Development at Long Grove Pharmaceuticals, Chicago. Now, I would request Dr. Saxena to throw light on the topic for Dr. Praveen Shinde.
Dr. Praveen Shinde has more than 16 years teaching and research experience. He has done his postdoc from University of Torino in Italy, and his research area includes many research areas, but mainly novel sensors, control and sustained release drug delivery systems, nanoparticulate drug delivery systems, transdermal drug delivery systems, biocarriers, and DOE-based targeted drug delivery systems for protein, peptides, and DNA-based formulation. He has more than 115 national and international publications. He has more than 7 patents on his name, and he's working with several and leading several government-funded projects. I'm happy and pleased to invite Dr. Shinde for his next talk, which is very interesting, paper-based biosensing strips for detection of asthma and kidney cancer using miniaturized system. I would like to welcome and invite Dr. Praveen Shinde for the talk. Thank you.
Here, today my topic for presentation is, that will mostly I can say that is paper-based biodiagnostic, or we know that we cannot afford the biodiagnostic mostly in the medical shop or in the hospital. So in that case, we invented the new technology where we can say that the pocket biodiagnostic. So in this case, the topic is paper-based biosensing strip for the detection of asthma and kidney cancer using miniaturized system. So, if I want to say the commercialized products for the biosensing, you know that glucose monitoring devices, pregnancy strips, and COVID-19 detection kit. Now, in this glucose monitoring test, you are aware of 3 enzymes mostly we are considering. First one, hexokinase, second glucose, glucose oxidase, and next is glucose 1 dehydrogenase. In pregnancy case, we are biosensing SCG, human chorionic gonadotropin hormone. In COVID-19 kit, we are finding the antigen to SARS-CoV-2 enzymes present in the nasopharynx. Now, based on this, it's very difficult to find out the disease condition in the primary level. So, we are considering the concept of the biosensors. Now, biosensors, here, this is nothing but the bioanalytic from the biofluid. That biofluid will be your saliva, lacrimal secretion, or any sweat, or any type, plasma, semen, or any type. We are considering this biofluid for the detection. So based on that, I can say that the biosensors mainly measures biological and chemical reactions, and this is nothing but the bioanalytes that convert into the sensing, and that gives the signal in the electrical form, and that we are detecting in the different form. In this case, we are considering that there is a color change, and that is come under the piezoelectric based sensors. So application of biosensors, soil quality monitoring. I think most of you know the biosensors are, we are always restricting ourselves in the pharma where we are limited knowledge of the drug carrier, but such type of the devices already in the market. Here soil quality monitoring where the pH and micronutrient of the soil we can test. Food quality monitoring. If the person want to eat the samosa also, with the biosensor he can find out what is the date the manufacturer or the person prepared that and how old or the fresh one you are eating. Then coming to the pathogen discovery where the drug screening we are performing, drug discovery also where we are screening out the drug, then toxin detection, any type of the, most of the time you know that there in the Vidarbha region or some region where the farmers are making the suicide using the pesticide or insecticide. Here the toxin detection, that is pesticidal, or you can then you are making the adsorbent and which has the ability to adsorb fast. Then water monitoring, that is for the purification of the water, and secondly that is removal of unnecessary ions present in the water. Disease detection, this we are considering in the coming slides. Environmental monitoring where we are refreshing the air by absorbing the pollutants. So, in general, the advantages of biosensors is a highly specific, rapid and continuous measurement, fast response time, transportable and better stability, easy to use and disposable. And because of this, when we are talking about the biosensing system, we want to make it affordable with the lower income or middle income countries. So in this case, the first case, that is the asthma, where you know that there is a constriction of that vessels, and because of there is a difficulty in the breathing. So in this case, I can say that the asthma is major non-communicable disease, and here there is a obstruction in the airway, and secondly there is a bronchospasm, and because of that there is always difficulty. If I want to tell, the cardiac arrest and asthma attack mostly happen in the early morning. So if I say that the national and international status of the asthma, here you can find the maximum that asthma study performed in USA, where we can say 26 million American diagnosed, 1 in 12 children, $50 billion annual cost they spent, 4145 deaths annually happened, and 13.8 million students missed the school, 14.2 million people missed the work days, 3 in 5 here they didn't perform the physical activity, 71% misuse the inhaler, and 1 in 5 cannot afford the medication. So here also 1 in 5 cannot afford the medication. So apart from the America status, we are coming to the India. Here India, that is the home of over 30 million asthmatics and accounting for 13.09 of the global burden. And then when it comes to the mortality, over 42% of the all global asthma deaths happen in India. So here you can see the proportion. India is the home of asthma. So what do we need? We need the affordable paper-based system which can easily detect the asthma and then you can throw it. So like your litmus paper, we can prepare such system. I think if you know that, mostly the students know that, if you are visiting the doctor this day, doctor will prescribe you the cough syrup if there is a common cold. Nowadays, the pattern is totally changed, where he is mentioning cough syrup containing the Montelukast, anti-asthmatic. Okay? Here the thing happened, that is unnecessary exposure of the anti-asthmatic drug to your body, that we want to completely restrict, and because of that we are coming to this asthma. Now in this case, if I can say the asthma, it is not at all treatable like diabetes. And if you want to perform any type of the treatment, okay, that can be happen with the medicine. But here there is no complete cure. So for that, early detection is the best way to avoid the further complication. So in this case, the asthma diagnosis, mostly we are doing with spirometry, peak airflow or trigger test, where we are using the histamines also. But the limitations of these methods were inconvenient, low availability in the hospital setup, or sometimes only available in the big size hospital. Now, perform under the supervision of trained personnel. So, these are the lot of limitations associated with the detection. So, to avoid this, we are looking for the paper strip which is used for the early diagnosis of the disease, replicable, profitable, disposable, easy to use, miniaturized form, and point of care and accurate diagnosis with very low cost. And that is why we are moving with the new type of the biosensing devices. Now, when there is a exhale air, the exhale air contains multiple components. Here, inorganic compound, volatile organic compounds, and here some type of the components that we are not counting. Now, in this case, these VOCs come under the class of some type of the gases, where we are saying nitric oxide is one of the biomarker for the detection of asthma. And because of this, how the nitric oxide form in the body? When there is nitric oxide excess that is produced from the exhale air, and this exhale air from the L-arginine by the eosinophil, and this happens in presence of nitric oxide synthase enzyme, and because of that there is a rise in the level of the nitric oxide. And that's why if there is an exhalation, there is a high content of the nitric oxide present. So when we say that the high level of the nitric oxide, here I can mention that this nitric oxide divided into three levels: low, intermediate and high. And here in the asthma, we are considering the high level of the nitric oxide level, where I can say that this nitric oxide more than 50 in adults and 35 in children considered as a phenotype for the asthma, or this parameter we can further use for the detection of asthma. So in this case, this is all about the history of the asthma, or what are the rationale. Now coming to the objective, we are developing the paper strips which is cost effective, nanosponges based, and that is the miniaturized form. Eosinophil inflammation detection, that is mostly happen in the asthma, and this will be the one of the most sensitive method when we are comparing with the marketed product. So in this case, just I am giving the in detail. I will coming to the coming side. Cyclodextrin we are cross-linking with the net, and this inclusion complex then we are treating with the cross-linker, that is the PMDA. We are getting the network of such type of the compound. This we are absorbing on the paper strip, and this we are detecting using the mobile app, and that will give you the complete color detection, and that color detection is responsible for whether the patient is asthmatic or not. So in this case, we use two methods. The preparation of the inclusion complex, where we use the cyclodextrin, which is means as a inclusion complex former, but here that is the masking for the 1-naphthyl ethylene diamine dihydrochloride, that is the NADE, okay? And this completely present in the cavity, and after that, this complex, we are making the cross-linking reaction, or we cross-link that one with the help of PMDA, that is the pyromelodic dianhydride. And because of that, there is a continuous structure, and this continuous structure where that NADE is present inside the cyclodextrin. So FTI and ESC studies show that, okay, one more that parameter I missed. Here, after this addition, we are further treating with the sulfanilamide. That is, here, when there is a diazotization reaction, there is a change in the color, and this color change from white to orange red. And that's why we are keeping on the top side sulfanilamide, okay, cyclodextrin, and in the cyclodextrin, there is the NADE, okay, and this is the complete cross-link network that we are considering on the paper strip. So before this, we done the FTI and DSC study, where we can say that there was whatever we are expecting, we got the very good result, that the adsorption of sulfonilamide on the cyclodextrin, and same time here the NADE is totally adsorbed, or we can say masked inside the cavity of cyclodextrin. Now in this case, there is a presence of the carbonyl bond, and that carbonyl bond responsible for the formation of the or conformation of the nanosponges. So after that we perform the same studies where we got to know that the particle size in the nano dimension, and these nano dimension particles are further loaded on or further sprayed on the paper strip. So here you can see that this is the nanosponges system where NADE and sulfonilamides are present, and this we sprayed on the paper, and this is responsible for the color change reaction. So these are the some images of the paper strip. After the application of that nanosponges dispersion on the paper strip, we are getting such type of the dimensions. Now, in this case, mostly when we are performing the research, that means in India, just I want to tell you, when we are performing the research, that time we are always considering the development of the strip. We never considering the preparation of the device. And that time we prepare the paper strip. Then we send the paper to the journal. Journal asks for the device. Okay? Then again we started with the device preparation, and there was an issue that device preparation, that you know that the pharma industry, they are not easily catching anything. So in that case, we visited so many shops or so many healthcare professionals to find out the device, but we didn't get. Lastly, this is the bottle, plastic bottle, okay? We split from this end, and this is the opening of that bottle. And here we place the paper strip, okay? This is the one of PhD student, she is blowing, okay? And there is a color change. That color change we monitor on the smartphone. The software was color graph, which is showing the RGB values. Now in this case, as I mentioned, there is a software, okay, and this is based on the HSV value, that is H value, that is the pure color, S value, that is the whiteness of the and V value, that is the lightness or darkness of your color. So on that basis, we validate the system. And in this case, if I want to tell you, we detected the different concentration 20, 30, 35, 40 and 50 ppb, parts per billion, and where we treated with the nitric, that is nitric oxide, we purchased from the market, Mumbai market, it's a 99.99 pure, and then we treated, and from that we got to know that there is a color change at the different dilution, or I can say different volume. Now after that we perform the validation with linearity, reproducibility, specificity, LOD and LFQ. Now all these things we happened with the help of smartphone. Now on that basis we decided I mentioned that previously HSV, who saturation and value, where we find that this saturation value getting changed as the concentration of the nitric oxide change. And on that basis we mentioned that when there is a higher concentration of the nitric oxide during the asthma condition, so ultimately there will be the change in the color of the paper strip. So to find out the comparative study with the marketed formulation, this is the Neox Mino instrument, that is the patented technology of Sweden company, and this is the cost of this instrument is around, before COVID it was 7 lakh, now might be it is 10 lakhs. Okay, here you can see that girl, okay, exhaling the air, and that is showing on the monitor of that computer. So in this case, this paper strip, whatever the validated paper strip we prepare, that we compared with the standard one, that is the Neox Mino, and here that 50 healthy individuals we tested, and we found that there is no wide difference between the standard instrument and our paper strip. And here you can see that there is 20.54 and 20.55, that is somewhat close to each other. That means our paper strip is working with this. Now the issue, as I mentioned, we have done this on the 50 healthy individuals, not the asthmatic people. And because of that, here that the study is still going on, we are asking that, and one of the United Kingdom company startup, they asked for this product, and now we are in the process that to collaborate with them. Okay, this is the first, and now coming to the second one. Here the paper sensing strip for the detection of renal cancer. Again, if you see the case of Asia, where the maximum person, that is 36.6% people are there prone to the renal cancer. Now after that the Europe, then North America, Latin America, then Africa and Oceania. So when we are considering there is a need of renal cancer detection system in case of, in India, where we are saying that lower income and middle income countries require such type of the system. So for that, these are some techniques which are detecting the cancer: abdominal imaging, MRI, computed tomography, that is CT scan, and ultrasonography. When we diagnose, only 25 to 30 patients are with the metastatic disease, and these are mostly treated with the detected with the ELISA and Western blot analysis. So we move further, and for that we can say that paper-based biosensing strip for the detection of renal cancer, and in this case we consider this aquaporin 1 that is the biomarker, okay? And this increase in the concentration of aquaporin in patient, this defines the early diagnosis of renal cancer. And with this, we can say that median urine aquaporin 1 level was 225 nanogram per mg, and this versus 1.1 nanogram per mg in healthy patient. And that's why you can see the difference where the system, the normal patient and normal person having only 1.1, and there is 200 times more increase in the concentration of the aquaporin. So in this case, again the system with the beta-cyclodextrin, and we are using the TBPB, that is tetrabromophenol blue dye. Again we cross-link with the pyrolytic dianitrate, and we are getting the dispersion system, and this dispersion system we then further analyze using the urine, and this color sensing device or smartphone we use with the help of the app, and there is a change in the saturation volume. This indicates there is a case of renal cancer condition. So if I want to tell you the sequential step: collection of urine sample, dip the paper strip in the collected sample, remove and wait for 5 seconds, detect the change, color change, scan it using the app. Positive sign of the RCC, consult your physician. Negative, no sign or no consultation is required, and after this, discard the strip. Okay. So for this also we performed the DSC and FTIR, and where we found that there is the complete masking of the dye in the beta-cyclodextrin, and this is again the nano size formulation, and this nano size formulation we place on the paper strip. Here, the previous case, there was a color change from white to orange red. Here there is a color change from blue to the yellow color, because there is a change in the base, that pH value, from alkaline to acidic, and that is the indication that if the person having renal cancer, that there will be the change in the color. So validation of the strip using the again RGB value, and on the basis of RGB value I can say that again the saturation value here it is getting decreased, and on that basis we can say that the person having the renal cancer. So based on these two, I can say that we are in the stage of development of biosensor, that is the affordable and mostly that will be used by the rural people, and discard, and I can say that this is coming trend that the pocket biodiagnostic will be with you. When there is a curve or there is a problem, you can just exhale the air, find out the disease, or sometimes if there is a urine infection also, you can just test that and you can find which are the diseases, or you are completely disease free. Okay, thank you. This is my total group. Thank you.
Shinde, very nice talk. I have 2 questions.
Yeah.
About 30 to 40 asthma patients. About 30 to 40 asthmatic patients do not produce nitric oxide.
Yes.
So what is the chance of false negatives? And
Yeah, in that case, see what happened that time, we are in the hurry to file the patent, because that idea was innovative and all this thing. Now we tie up with the hospital. That was the normal people data I showed, because we want to just find out the marketed that device and our system working in the similar way. Now it is working in the similar way. Now we tied with the hospital, one of the government hospital. But now the issue is that the frequency of the asthma patient. Okay, so that's why they are told, okay, you have to wait for 2 years. The number, if it is getting means high, more than 100, we are considering that case. If it is more than 100, that statistical design will be very good. And that's why we are waiting for the patients now.
Well, my second question is, what is the cost of these paper strips you are expecting?
Hardly 3 rupees.
Great, thank you. Very good.
One more quick question. In terms of binding to the paper, that you have a nano sponge that
Yeah.
you made and then you are impregnating it.
Yeah.
Is it the physical force that is holding the nano sponge?
Now see, what happened in this case? It's a deposition. It's a deposition. I can say that. It's a paper, porous nature, it's a filter paper, Wattman filter paper, okay? And we are just spraying with our formulation, I can say the dispersion. This nanoparticle system will totally deposited on that, and this will give the color
It's
change.
a physical entrapment
Yeah,
of the particles.
yes.
What size did you show us? I don't remember seeing particle size.
It's the size between 300 nanometer to 600 nanometer.
Thank you, that's all.
My question is that aquaporin that you talk about,
Yeah.
when we have traumatic brain injury to overexpresses, then what will be the scenario?
There are some restrictions with this system where I can say that if there is a renal inflammation or any type of the kidney disorder, okay, there also the aquaporin level increase. So here in asthma condition also I can say nitric oxide level will increase in case of non-vegetarian food also. So we are restricting, we are restricting that for the further. But this is why we are considering this, because so many systems available in the market, they have some restriction. But this is the cost-effective kit that will be hopefully coming into the market.
Hello sir,
Yeah.
my question is how much time it will take to show the result?
30 seconds.
Okay.
That's why that is the beauty of the nanotechnology here we use, because just now to mention this, right now we file one patent on the pregnancy kit. Okay, the pregnancy kit mostly that Prega use and all, it is showing the result within 1 minute. Okay, and 99.5% that is the accuracy. But still there is a problem with the 0.5. We right now solve 99.9%, 0.1% is still remaining.
Okay.
So that's why I'm telling, these are, means nanotechnology will totally cover that area, and here we are considering that particle size is less, porosity is high. So whenever the biomarker come in contact with that, so ultimately there will be the color reaction.
So the result in the form of color.
Yeah.
So how will you set the chronicity of the disease?
Chronicity of the disease, I told you,
Yeah.
positive, negative, yes or no. If it is yes, consult the doctor.
So
In
okay.
this case, see also, we are preparing the strip, that color coding. But the issue is that there is a variation in human to, means person to person, and where we are not considering that is mostly detectable. So it's better that we are saying that positive or negative. That's all.
Okay. So my last question is that like you are saying that the nano gas, okay, nitrous oxide gas,
Nitric oxide.
nitric oxide gas, it show the result. Is there any environmental effect of this paper?
Yes, there is an environmental effect. In this case, whenever you are preparing such type of the system, okay, this system, if you are keeping for a more than 5 minutes in the atmosphere, it will change the color. And that's why the packing of this system is playing important role, where we are keeping silica, that gel, and that is a complete pack that in presence of inert gas we are means packing that.
Okay. Thank you, sir.
Okay.
So the question I have.
Okay.
So how you can improve this in stability? Because 5 minutes.
No, it's not stability. It's we are saying that this is all about when you are keeping this in the environmental condition. Stability, that I can say that here it is the 1 year. Okay?
No, I'm not talking about the stability of the system. The problem is that once it's goes to the patient, no matter how many instructions you write, it's very difficult to
In that case,
instruct the patient.
no. In that case, we found the solution that if you place this paper strip in the device, I showed you the slit on that bottle. If you place this in the container, okay, that device, it will be the totally closed system. Whenever you want to use, you can.
Yeah, see, the whole idea is that you have to come up with something so that no matter what, patient take it out and he got a phone call, he put the strip from the, and it happens.
Yeah, it
In
happens.
real life, it happens.
Yes, that's why. Means here that the alternative of this is that we are trying to prepare some types of the membrane filter like system where, or I can say that the lens like system of the microscope. You just place and close the system, and whenever you want, you can use that one.
Sir, I got one question. Sir, you added that sulfonilamide in that reaction.
Yeah.
Sir, why you added that sulfonilamide?
This is a diazotization reaction.
Okay, sir. No, in diazotization, and that react with cyclodextrin in place of
No, see
No.
whatever. I'll just tell you the reaction. Lead, okay, 1-naphthyl
1-naphthyl, yes.
ethylenediamine dihydrochloride present in the cavity of cyclodextrin.
Yes.
Okay, now we are cross-linked with the PMDA. Okay, and then there is the adsorption of the sulfanilamide on the surface. Okay, now when there is a diazotization reaction, nitric oxide directly act with the sulfanilamide. Okay, this is the porous structure. Okay, this porous structure transferred to the net, and then there is a diazotization reaction. So azo compound is formed, and azo compound is responsible for the change in the color. Anything? I hope you like this. Thank you.
Thank you, sir. Thank you so much for your words of wisdom. It will be a great pleasure for us to listen to you again in our future events. Now, I would request Dr. Shikha Agrawal to present the memento to Dr. Saxena, the session chair, and Dr. Shinde, the keynote speaker.